Hello friends, as we know, there is a pandemic going on with COVID-19 infection and we are all ready to start working with all precautions for prevention of COVID infection to our patients. So what are the things which we are taking care of? We are taking care of each and every steps and places where the COVID can spread to ourselves, to our staff, to the patients. We are doing all online consultations by video conferencing, avoiding direct patient and doctor and staff interactions. Whenever we are in the final stage, we call the patients 2 days prior to surgery and get a COVID test done. We make sure all the patients which we are operating are COVID free. We take proper history of contact and travel, relative, friends, surroundings, and the movement in last 14 days. If there is no contact history and no symptoms of the patient, we undergo a subjective test of COVID, that is PCR. Once the COVID infection is ruled out by the COVID test, then only we take the patient for the surgery. So any patients who is being operated at our center are COVID free. So there are no chances of getting infected from the previous patients to our staff or to the doctor or to the future patient. What about the staff? How we are preventing infection from the staff to the patients? The most important point in that, we have all the staffs which are living with us in the same building, in different room. They are being quarantined since last 2 months. So all the staffs which are working at our center are in-house. They are not coming from outside. They are infection free. They are quarantined, there are no symptoms, so we are very much sure anybody who is working at our center is corona free. Although we are getting routine checkups for their health, when there is a patient who is coming without any symptoms, and even if he has undergone tests and corona negative, there might be few chances that he might be having some corona infection. So we are still taking all the precautions to prevent infection spread from a asymptomatic patient to doctor and the staff. How? Once the patient is entering in the clinic or the building, we first of all take primary temperatures of the patient. We give them shields to cover the face. The shield will help in droplet infections. Then what we do is, when the patient enters in a clinic, wherever he touches, we clean that surface once the patient leaves the hospital. We clean all the areas, for example, staircase railings, lift, the premises in the bed where the patient is lying down, the surfaces which he has touched, the room's handles, knobs, washroom handles, everything is properly cleaned, the surface disinfected. The room is disinfected with a fogger or a spraying machine with hypochlorite solution. So the room, the operation theatre, and the cutting chamber all are cleaned twice daily with the surface disinfected and fumigated every night to be ready for the next patient. We make sure every staff who is working at Medispa will be wearing a mask, a shield, and having a personal hand sanitizer. So whenever he touches either a phone or a table or a door handle, cleans that surface area before touching as well as after touching the surface area. We make sure that nobody will catch corona infection while coming to our clinic or visiting our clinic for surgery. Thank you.